It's a new record. More than 500,000 cases of COVID-19 were recorded in France in 24 hours, much higher than its European neighbors and second only to Denmark in cases per capita. And those numbers have been staggeringly high the entire month. Since New Year's Day, 1 in 10 residents of France has tested positive for the virus. The wave of infections is linked to the very high number of tests that are carried out, but that's not all. Pandemic fatigue and schools remaining open have made the situation ripe for an exponential spread. Working from home, which in theory is mandatory 3 to 4 days a week, has been hit and miss, with many companies dragging their feet. Stores and non-essential businesses have also remained open. Data released by Google, which analyzes device tracking information, shows that all of this has made people in France much more mobile and much less prone to staying home than residents of neighboring countries. And the much more contagious Omicron variant is believed to make up as many as 96% of all new cases.
There's a before and after Omicron. This is a variant that is much more contagious, but significantly less severe, significantly less. That means that our view and our way of dealing with this virus must change.
And that is what the French government has done. Authorities have gone all in on vaccination, turning the country's health pass into a vaccine pass. Millions of unvaccinated people are now effectively banned from large parts of public life. There is some good news. Despite the number of hospitalized patients at its highest since late 2020, the number of people in intensive care units is slowly on its way down. So far, the government is still on track to begin easing restrictions as early as next week.